vision screen adults. So we went through what a vision screening is, the common vision conditions for adults, and now we're going to get into the components of an adult vision screening. So when it comes to an adult vision screening, there are 4 main stations that we cover: registration and risk assessment, and then we go into testing adults' near and distance visual acuity, and then we do the exit interview, which is going over their results with them and then next steps to vision care. So to begin with, what we're going to do is we're going to go over the registration form and the perceived need form. So when a client sits across from you and you're starting the vision screening, each one is going to start off with filling out the perceived need form. This is 5 questions, and this is going to be block 1. You will ask the client these questions, and they will give you a response 1 through 5 on where they feel on that scale for each question. You will ask block 1 questions. Once this is complete, you are going to go to block 2 questions on children's vision health. We really want to learn about how families view vision health, not just adults, and to see if their viewpoints will shape how their kids grow and develop and have viewpoints on vision health when they are adults. So you then are going to proceed asking questions 1 through 4 on block 2, children's vision health. Once the client answers questions on block 1 and block 2, you are going to proceed on with the statement of screening. The statement of screening is extremely important and must be agreed to and signed by the client you are screening. This states that it is just a vision screening today and it is not an eye exam. By them signing this, they agree that they understand what is going to be in the vision screening and it does not replace an eye exam from an eye care professional. After the client signs a statement of screening form, you are then going to take them through the adult vision screening registration form. The registration form collects contact information on the client you're screening, so we want to fill out the top half: name, address, phone number, date of birth, and if they have an email address. Phone number is imperative to put down if they do have one, because this is how we are going to follow up with the client if they do not pass their vision screening. If the client cannot see this, you can ask them the questions and fill them out for them. After we fill in the contact information, it does ask if the client does have vision insurance. Circle yes or no. If they have vision insurance, please ask them, is it private insurance through work? Is it Medicaid or Medicare? And if they have no insurance, we will simply circle no on the form. After the contact information is filled out, we are then going to proceed on to asking questions on the adult vision health risk assessment. Now, the risk assessment is an imperative part of the vision screening. About 98% of adults will not pass this section. It is 10 questions that ask the adult on their previous and current vision health conditions. There's a reason we went over those common vision problems earlier, because each of these questions dives into some of those vision concerns we've covered. So they simply will answer yes or no to the questions on the risk assessment. After they are done with the risk assessment, we want you to pause here and review their registration form. You can decide if the client does not pass the risk assessment. You can go over their results with them based off of this, give your recommendations for next steps to care, and they can be done with the screening. However, if they pass the risk assessment, or if they would like to know where they stand with their distance and near acuity, you can go on and test those using the designated charts. To review the risk assessment, what is considered a pass and what is considered a referral for adults? Question number 4 on the risk assessment. If your client you're screening answers yes to this question, have you noticed a change in vision in the last 12 months? If they say yes to this question, they are going to be an automatic referral. Also, if they answer yes to question number 10 on the risk assessment, if they have diabetes and it's been more than a year since a dilated eye exam, it's going to be an automatic referral. Now, if the client has diabetes, but they say no to question 10, that is not an automatic referral. It's just if it's more than a year since that dilated eye exam. I also want to pause and note on question number 5. You will see it is highlighted in red. Do you experience any type of pain or discomfort in or around your eye? If you have a client that answers yes to this question, I want you to pause and do a little bit more investigative work into this question. This is referring to that closed-angle glaucoma condition we covered earlier. If they have a severe sharp pain in one or both of their eyes, and you almost see a physical characteristic underneath the eyelashes here on the bottom lash, it almost looks like it's bulging out, those would be symptoms of closed-angle glaucoma. If you suspect the client you're screening has those symptoms, we stop the vision screening and we refer them to their eye doctor right away or to the ER. It is up to the client on their next steps of what they're going to do, but if you do suspect that that is symptoms of closed-angle glaucoma, we stop the screening immediately. However, you might have an adult that says yes to question 5. That's why we like to ask follow-up questions. What is that pain like? Is it persistent? Is it sharp? Does it go away? Sometimes adults say yes to that if they have allergies, if their eyes are running, or if they have dry eye. We don't want to send someone to the ER if they have dry eye. So just use your best judgment with that question. So if they answer yes to question 4 or 10 or both, you know it's going to be an automatic referral. However, if you have an adult that does not answer yes to 4 or 10, but they answer yes to 2 or more questions on the risk assessment, they would be referred on for further care. So again, 4 and 10 are automatic referral questions, or if they answer yes to 2 or more questions on the risk assessment, we would refer them on to further care. You can see it's very hard for an adult to pass the risk assessment section. So that's why you can refer them based off of this. However, if they don't pass and you do want to test their near and distance acuity, you can move forward after you review the risk assessment. Once you reviewed the risk assessment, you can decide on whether you want to take your client through the near and distance acuity section of the screening. If you do choose to screen near and distance acuity, make sure you ask your client if they wear prescription lenses. This can be bifocals, progressive lenses, or reading glasses. We just want to make sure that they're wearing them for the appropriate vision screening stations to make sure that strength is correct. So first we're going to go into how do we vision screen adults near acuity. With this, we use a handheld chart. On the chart, there are 2 sides to it, and this will determine which eye you will screen. On the right side of the chart, we have a string that measures the distance. This measures 14 to 16 inches from the client's eyes. We always vision screen the right eye first and then proceed to the left eye. Again, if the client that you're vision screening wears reading glasses or prescription glasses to see up close, make sure they have them on during the screening. We always screen the right eye first and then proceed to the left eye. During the near acuity screening, you are going to be referring to your near acuity cheat sheet. This is going to be your guide as the client tells you what they're seeing on the chart. So you are going to instruct the client that they are going to take an occluder paddle. You see there is a fat portion of the occluder paddle here. They are going to put that up at an angle up next to the bridge of their nose. Make sure if they are wearing prescription glasses to cover over the lens instead of underneath. That just gets clunky sometimes. To make sure we are on the correct side of the chart, you are going to look for the Z at the top on the very end. You will see this correlates with your cheat sheet. There is a Z right at the top under right eye. For left eye, you will see as you flip the chart, there is a V right at the top. So there are 2 different sides. We always start with the Z at the end at the top, and then as we proceed to the left eye, we start with the V. You see there is a Z on the left side, but it is not on the very end. So that will determine that you are on the correct side for each eye. Also on the cheat sheet, there is a highlighted column. You're going to start with the Z with the client, and as they name letters, they are going to read down and you will follow with them. This just helps prevent you from craning your neck over and trying to determine where they're at on the chart. With this, you are going to have the client hold the string and the occluder paddle in the same hand. Make sure again that fat portion of the occluder is up at a diagonal up against the nose, over the lenses if wearing. You can see the string is nice and taut. We don't want it here, here, or here, nice and straight in front of them. You are going to instruct them to please start with this letter, again, the Z at the top, and you are going to instruct them, please read down this column for me. Okay? You can see this column follows along with that highlighted column in the right eye on the cheat sheet. So please start with this letter and read down this column for me. As the client reads down that column, you're going to make sure that the letter they say matches the column on your cheat sheet. The critical passing line for near acuity for adults is the 20/40 line. Once the adult reaches the 20/40 line, they must get 3 out of 5 letters on that line to be considered passing in that eye. You will see on the cheat sheet, we highlighted over the passing line. So you can simply stop if they get down to that passing line, tell them to please read across on that line and document how many they get correct. Again, 3 out of 5 on the 20/40 line is considered passing for adults. However, near vision is something that does go as we tend to age. So it is not uncommon for an adult to mix up a letter above the 20/40 line. If you go down with the client and they do mess up a letter, you're going to have them stop and read across on that line that they said the wrong letter on. If they can get the majority, so 3 out of 5 on that line, you're going to proceed down 1 line for them. If they get that next letter correct on the line below, you do not have to take them across. Just proceed 1 letter down on each line until they get to the 20/40 if they can. If they cannot get to the 20/40 line, adults are very honest and they can say, you know what, I just can't see past that line. Perfect. Take them down to the line that they can see, take them across. If they can get 3 out of 5 on that line, that is going to be their visual acuity score. After we do that for the right eye, we do the same process for the left eye. So you are just going to flip the chart over again. So the V is at the top on the outside. They are going to hold the string in their hand, and they are going to cross over, covering the right eye, testing the left eye. Now this string does cross over on the chart, but if the client does adjust the string, they do have a clear view of the chart. You are going to do the same process on the left eye, starting with the V. You can say to the client, please start here and read down this column for me. It's going to follow the same column, just on the highlighted portion of the left eye on your cheat sheet. Same process, 1 letter per line down to the 20/40 line. If they can get down to the 20/40 line, you will tell them to stop and please read across for me. They must get 3 out of 5 letters on that 20/40 line to be considered passing in the left eye. Again, if they cannot get down to the 20/40 line, take them down to the line where they can see, take them across. If they get 3 out of 5 on that line, that is their acuity score. If you have an adult that can go down to a certain line and cannot get 3 out of 5, you will move them up a line and take them across until they can get the majority correct. After you vision screen their near acuity, on the registration form, you will see there is a section to fill in their near acuity score. You are going to check the box if they wore reading glasses or prescription lenses, and then you are going to document their score for their right eye and their left eye, 20/40 out of 20/40, Or, for example, if they didn't pass, 20 out of 50 and 20 out of 63 in the left eye. Now that the near acuity screening is complete, we will proceed with the distance acuity screening. During the distance acuity screening, this is a testing distance of 10 feet. What we are going to do is put the Sloan wall chart on a nice, brightly lit wall. You're going to hang it at eye level for the client. If you have a client who is a little bit taller or shorter, you can move the chart up and down. Just make sure the client isn't craning their neck up or down. From the wall, we're going to measure 10 feet out. At that 10-foot marker, we're going to put a strip of masking tape down. You're going to instruct the client to stand with the heels of their feet on the 10-foot line. We're going to test the right eye first and then proceed to the left eye. We will be using the occluder paddle we used in the near acuity screening. Again, if an adult has prescription lenses, bifocals to see far away, make sure they have them on during the screening section. Testing the right eye first, we're going to instruct the client to put the occluder paddle up over their left eye. Again, the fat portion of the occluder at a nice angle, nice and tight. Just make sure that you see no peeking occurring. Once that left eye is covered, you as the screener are going to stand next to the Sloan wall chart. When you're pointing to letters on the wall chart, you want to make sure the pen or the pointer you are using is underneath the letter and that there is enough space between the pointer or pen and the letter itself. If we are very up close to the letter we are pointing to, it might look like a different letter for the client, and in reality, they might be able to see it but say the wrong letter name. You are going to work your way one letter per line as they get the letter that you point to correct. So for example, on the 20 over 100 line, the starting line, if you point to the K on that line and they get it correct, great. You're going to proceed down to the next line and point to one letter. If they get that letter correct, you're going to proceed down to the next line. You're going to work your way down until they get to the critical passing line, which is 20 over 40. On the wall chart, the 20 over 40 line is labeled on the right-hand side of the chart. On the other side of the chart, you will see that the acuity scores are labeled as, for example, 10 over 100, 10 over 60. We always want to record what is on the right side, which is 20 over 40, 20 over 63. If they get down to the passing line of 20 over 40, you're going to stop and you're going to take your pointer and you're going to go across that 20-40 line. Adults must get 3 out of 5 letters on the 20-40 line to be considered passing in their right eye. If an adult cannot make it down to the 20-40 line, say they get stuck on the 20-63 line, you want to make sure they can get the majority on that line correct before you move them down. If they cannot get the majority correct, you will move them up a line and take them across that line. If they can get 3 out of 5 correct on that line, that will be their acuity score. Again, whatever is labeled on the right side of the chart for that line. Now that the screening for the right eye is complete, we're going to proceed with the same process for the left eye. You're going to take the occluder paddle for the client and they're going to cover their right eye completely, testing the left eye. We're going to start with our pointer or our pen at that first line on the wall chart, 2100. One letter on the 2100 line. If they get the first letter that you point to correct, you're going to move down a line. As they get each letter that you point to correct, you're going to proceed down the chart one letter per line. Once you get to the 2040 line, you're going to stop and take the client across on that line. This is the passing line. They must get 3 out of 5 correct on this line for 20 out of 40 to be their acuity score and for them to be considered passing in the left eye. However, if you're working your way down the chart and a client does not get the letter correct that you're pointing to, you're going to take them across that line entirely. They must get 3 out of 5 letters correct before you move them down a line. If they cannot get 3 out of 5 letters correct, you will move them up a line and see if they can get the majority or 3 out of 5 correct on that line. If they can, that will be their acuity score. Again, marking down what is on the right side of the chart, whether it be 20/40 or 20/63. After you are done vision screening the left eye, you are then going to document the client's visual acuity score for distance. Again, checking the box if they have prescription lenses on or contacts, and what their acuity score is for the right and the left eye. The next part of the vision screening is going over the results with the clients. This is an imperative step. We want to make sure that they understand what their next steps are to care. This is the exit interview section. In the exit interview section, you are going to go over the risk assessment with them, and if you vision screen their near and distance acuity, what those scores mean. The risk assessment portion, you are going to go over if they answer yes to any of these questions. Why does that put them more at risk for a vision problem, and why does that cause them to be a referral to further care? Again, that is why we gave you that background knowledge into those common vision concerns. Also, if you did test their distance and near acuity, going over 20/40 in both eyes on both vision screenings, it's considered passing for adults. Anything above 20/40 is considered a referral, if it is in the right, left, or both eyes. After going over the risk factors and their acuity scores, if done that day, you are then going to go down into this section here. This is the exit interview section of the registration form. You're simply going to check if the adult is a referral based off of risk factors, which is the risk assessment, or based off of visual acuity, or both. You can check the box pass for a client if they pass the vision screening. Again, I want to emphasize, the risk assessment portion is the main portion adults don't pass in the vision screening process. So again, for an adult to be a referral on the risk assessment, if they answer yes to question 4 or 10, or they answer yes to 2 or more questions, they would be a referral to care. And again, for visual acuity, if adults score above 20/40 in either eye on distance or near, they would be a referral to care as well. I also want to mention as well, if you hear any complaints from the client on things are not as clear, or they're having a lot of discomfort with their eyes, they notice a change in vision, but even on the sheet it says that they pass, that can serve as a referral for the client. If you notice anything with their eyes, any appearance signs that might be worrisome, any bruising, redness, that would also be a reason to refer the client on for further care. Once you check on the registration form whether the client is a referral or a pass, you then are going to fill out the adult vision screening results form with them. This is the only form the client needs to leave the vision screening with. You simply will check the box that they passed or that they are a referral based on risk factors and or visual acuity. It is important to note that it should really be emphasized that the client takes this sheet of paper in with them to their eye exam appointment. Their eye doctor then fills out the second half of this sheet and sends it back to us, and we are able to follow up with them if any further care is needed. The last step of the vision screening process is having the client answer question 1 on block 3 of the perceived need form. Block 1 and 2 were all based on their thoughts of vision health before this vision screening happened, and now we can see if they have a different perspective on vision health after going through this process and having the conversation with you. They just need to rate 1 through 5 on where they stand on the question. Once question 1 on block 3 is answered, the adult vision screening is complete. Before the client leaves, though, it is important to talk with them and remind them that this is just a vision screening. It's not an eye exam. Those next steps to further vision care are going to be imperative for them on their vision health journey.